December 2007, Netta Robeson was diagnosed with ovarian cancer and died within 10 weeks.
We were absolutely devastated. It literally happened overnight. My mum was fine one day and in a lot of pain the next. We were told from the outset that the disease had spread so far and so quickly that all they would ever really be able to do for her would be to try and hold the disease at bay. And they were going to try to do that with surgery first and then chemotherapy. That was certainly their aim. It wasn't just the speed at which we got the diagnosis and that my mum went downhill so quickly, but that she didn't have long after that. That was quite shocking. You know, it's left a big void in our family, and there's no getting around that.
Ovarian cancer affects around 6,000 to 7,000 women a year in the UK. Symptoms are non-specific, but if detected early enough, there is a 90% chance of survival. Common symptoms are persistent stomach and abdominal pain, increased stomach size and persistent bloating, and difficulty eating and feeling full quickly.
Is never be afraid to go and talk to your GP and say, I've got symptoms, and to say that I'm worried about the possibility of cancer. Hopefully the GP is there to give reassurance, but also hopefully he will listen and pick up the symptoms, particularly if there are symptoms like bloating, which are now recognised as being more important. But he will use his clinical skills to try and identify those patients that need further investigations, whether it's with an ultrasound scan or other tests, so that they can be diagnosed with ovarian cancer at the earliest stage, and then they have a better chance of cure.
My gran's now 90 and she's outlived her daughter, and that's the hardest thing to take because it just shouldn't have happened that way.
Shirley Robeson hopes that in speaking of the loss of her mum Netta, more women will be aware of the cancer and more lives saved.